Alternative treatments for diabetes. Alternative treatments for diabetes. There have been some small, limited studies as well as anecdotal reports that certain alternative or natural treatments can help control blood glucose levels in people with diabetes or otherwise prevent the condition or prevent its complications. These can include herbs or dietary supplements. Examples include garlic, cinnamon, alpha-lipoic acid, aloe vera, chromium, ginseng, and magnesium. These substances are not considered to be medications by the US FDA and are therefore not regulated as such. This means that there are no standards in place to ensure that a given product contains the substance or dose as described on the label. There are also no requirements to perform studies showing that the products are safe or effective. Side effects of supplements are typically not well understood, and some supplements can interfere with the action of medications. The American Diabetes Association publishes treatment guidelines for physicians based on all available scientific evidence. In the 2018 guidelines document, Standard of Medical Care in Diabetes, the ADA states that there is not sufficient evidence to support the use of any of the proposed alternative treatments for diabetes. These guidelines state that there continues to be no clear evidence of benefit from herbal or non-herbal, for example, vitamin or mineral, supplementation for people with diabetes without underlying deficiencies. Routine supplementation with antioxidants, such as vitamins E and C and carotene, is not advised due to lack of evidence of efficacy and concern related to long-term safety. There is insufficient evidence to support the routine use of herbals and micronutrients, such as cinnamon and vitamin D, to improve glycemic control in people with diabetes. Diabetes type 1 and type 2. Diabetes is a chronic condition characterized by high levels of sugar, glucose, in the blood. The two types of diabetes are referred to as type 1, insulin-dependent, and type 2, non-insulin dependent. Symptoms of diabetes include increased urine output, thirst, hunger, and fatigue. Treatment of diabetes depends on the type. Diabetes diet plans discover the best and worst meals for diabetes-savvy dining. See how to avoid carbs and control your blood sugar with healthier meal combinations that retain all the foods and flavors you love. Type 2 diabetes diet plan. A type 2 diabetes diet or a type 2 diabetic diet is important for blood sugar, glucose control in people with diabetes to prevent complications of diabetes. There are a variety of type 2 diabetes diet eating plans such as the Mediterranean diet, Paleo diet, ADA diabetes diet, and vegetarian diets. Disease prevention in men. Disease prevention in men includes routine screening tests that are part of basic prevention medicine. Take an active role in your own health care and discuss screening tests with your doctor early in life. Age of screening and timing of screening depends upon the condition being assessed. Diseases men should take steps to prevent include high blood pressure, hypertension, hypercholesterolemia, type 2 diabetes mellitus, HIV, human immunodeficiency virus, colon cancer and colon polyps, prostate cancer, glaucoma, melanoma and other skin cancer, and bladder cancer. Glucose tolerance test. The oral glucose tolerance test, OGTT, or glucose tolerance test is a blood test used, not routinely however, to diagnose diabetes, and gestational diabetes. Information in regard to reliability of the oral glucose tolerance test is important, as some conditions, common cold, or food, caffeine, or lifestyle habits, smoking, may alter the results of the oral glucose tolerance test. Men's screening tests. Getting the right screening test at the right time is one of the most important things a man can do for his health. Learn at what age men should be screened for prostate cancer, high blood pressure, cholesterol and other health risks. Normal blood sugar levels, ranges, in adults with diabetes. People with diabetes can manage and prevent low or high blood sugar levels, hyperglycemia or hypoglycemia, by keeping a log of your blood sugar levels when you are eating and fasting and eat foods that are high in carbohydrates and sugar, for example, buttered potatoes, candy, sugary desserts, and fatty foods. Blood tests, for example, the hemoglobin A1C test, and urinalysis can diagnose the type of diabetes the person has. Diabetes during pregnancy, called gestational diabetes, should be managed by you and your OB/GYN or another healthcare professional. Extremely high levels of blood glucose in the blood can be dangerous and life-threatening if you have type 1, type 2, or gestational diabetes. If you or someone that you are with has extremely high blood glucose levels, call 911 or go to your nearest urgent care or emergency department immediately. To prevent and manage high blood glucose levels in people with diabetes, keep a log of your blood sugar levels. Eat foods that are high in carbohydrates, sugar, for example, buttered potatoes, candy, sugary desserts, and fatty foods that you can share with your doctor and other healthcare professionals. Diabetes. What raises and lowers your blood sugar level? Want to lower your blood sugar? Learn to better control your glucose levels by preventing blood sugar spikes and swings to avoid neuropathy and other diabetes complications. Find foods that lower blood sugar, and identify foods and activities that raise high blood sugar risks. Diabetes urine tests. Urine tests for individuals with diabetes is important to check for diabetes-related kidney disease and severe hypoglycemia. With proper monitoring of blood glucose levels, diabetic kidney disease can be avoided.